A year after construction of the Sewua Regional Hospital in the Ashanti region, residents remain uncertain about the facility when it will be put to use. Joy News checks reveal poor access roads to the hospital and the installation of a power source have been cited as reasons for the delay in putting the hospital into operation, though the Presidential Advisor on Health, Dr. Anthony Isiansari, has assured the road has been awarded on contracts. Nana Ojima has more.
The 250-bed capacity Sewua Hospital is one of 8 hospital projects costing $339 million constructed by Eurojet The Invest. By capacity, it is the third biggest health facility in the region and expected to ease pressure on the Komfo Anokye Teaching Hospital when fully operational. The Afari Military Hospital, with a 500-bed capacity, will be second largest facility when completed. Physical works on Sewua Hospital have been completed, awaiting provision of power supply and improved access road network. Health Minister Kweku Ajiman Menu, during a visit to the facility, noted the challenges with power and road have delayed the opening of the facility.
We are waiting for a few things. We call them client obligations. The client should bring road to access the facility. The inside the hospital road is part of the contract. But from Sewua town or from the major road to this place is supposed to be done by government. Here is virtually completed. All the equipments are in place. They are not bringing any new thing. They're only waiting for constant, continuous power so that we can run the machines after commissioning testing.
Presidential Advisor on Health, Dr. Anthony Isiansari, speaking on the probe on Joy News, indicated the power supply has been installed, with some work being done on the roads.
Another thing that we need to do in Sewua is a road network to the hospital. So it becomes easy for patients to be carried to the hospital and also come out from the hospital. That one is also being given, the contract has been given out, is being done. So Sewua is practically completed.
Love FM's visit to the hospital using the Prabon Sewua route indicates the road is in a poor shape, dusty and bumpy. Motorists have to navigate their way through the gaping potholes with tact. The widening potholes pose danger to road users.
For 4 years,
For about 4 years now, the road has remained poor. They usually come to grade the road and leave it. The road to the hospital is worse.
They say a quarter way for your friends. Bears and a woman, I have my bears and bo. Bears and apple office, I'm an overload and a bay was so saying a surprise woman who cry, I am.
It has been over 4 years since drains and bridges were constructed on the stretch, but residents have had their hopes of a tarred road dashed for years. A bridge well constructed in the middle of the road is not utilized fully as one end of the construction is left uncompleted.
A gaping hole was opened for the construction of this bridge, but after the work was done, the contractor refused to cover the hole that is left here. Now, even though the bridge is done, only a portion of the bridge can be used by drivers here.
Ebi lighting it, drone do a problem park is a pan, ebi lighting it. Inti bi honman won say ebi an we neighbor no.
2 weeks ago, an accident nearly happened at the spot. The drivers didn't notice each other. If the bridge was fully done, this wouldn't happen.
Sana a fence probably cabin sober. Taquano so or huno. To who ya high and a friend say. Even Baba couldn't cry tree. No, this answer or coney say into tree. Aquano natures umina. I mistake.
A drive to the Sewua Hospital is not a pleasant one. A decision to use the Feyasi route to exit the area was no different. Though the route is shorter, there is no sign of road construction. George Ejay, who is station master at the local taxi rank, says contractors packed out of the site months ago.
Hospital. Don't you quote and if you can see
The contractor milled the entire stretch, so we were waiting for the construction of the road itself. The drains were all done. Later, we noticed the contractor had taken away all equipment from site.
It remains unclear when Sewua Government Hospital will be opened to the public to help improve access to healthcare in the Ashanti region. For Joy News, Nanaya Ojima reporting.